Hip pain. It's a common complaint, especially as we age. But common doesn't mean it's something we should simply accept. For many seniors, hip pain is more than just a minor ache. It's a significant obstacle that can dramatically impact their quality of life. Studies show that a substantial percentage of older adults experience chronic hip pain, a number that unfortunately tends to increase with each passing year. Think about it. Hip pain can make simple activities, the things we often take for granted, incredibly difficult. Walking to the mailbox, climbing stairs, even getting a good night's sleep can become a painful ordeal. This, in turn, can lead to a decrease in mobility, making it harder to stay active and engaged in social activities. The resulting isolation and inactivity can then contribute to a decline in overall physical and mental well-being, robbing seniors of their independence and zest for life. And that's why we're here today. Our goal isn't just to acknowledge that hip pain exists, but to empower you with the knowledge you need to take control. We're going to delve into the top 5 most common causes of hip pain in seniors, offering clear explanations of what's happening inside your body. More importantly, we'll provide practical, actionable solutions you can discuss with your healthcare provider. From simple lifestyle adjustments to cutting-edge treatments, we'll explore a range of options designed to alleviate your pain, restore your mobility, and help you get back to enjoying the activities you love. So let's get started and unlock the secrets to a pain-free and active life. So, where do we begin on this journey to understand hip pain? The most frequent culprit, the number 1 cause of hip pain in seniors, is osteoarthritis. You've probably heard of it, perhaps even experienced it in other joints. But what exactly is osteoarthritis, and why does it affect the hip so often? Imagine the hip joint as a perfectly engineered ball and socket. The head of your femur, thigh bone, is the ball, fitting snugly into a socket in your pelvis. To ensure smooth, frictionless movement, both the ball and socket are coated with a layer of cartilage. This cartilage acts as a cushion, absorbing shock and allowing the bones to glide effortlessly against each other. Osteoarthritis, quite simply, is the gradual breakdown of this protective cartilage. Over time, the cartilage thins and wears away, leaving the bones exposed as they rub together. It causes pain, stiffness, and a reduced range of motion. You might notice a deep ache in your groin, buttock, or even down your thigh. Stiffness, especially in the morning or after periods of inactivity, is another telltale sign. Simple things like bending over to tie your shoes or getting in and out of a car can become incredibly painful. But don't despair. While there's no cure for osteoarthritis, there are many effective ways to manage the symptoms and improve your quality of life. Weight management is crucial, as excess weight puts extra stress on the hip joint. Physical therapy, with specific exercises designed to strengthen the muscles around the hip and improve flexibility, can make a huge difference. Pain medication, both over-the-counter options like ibuprofen and prescription drugs when needed, can help control pain and inflammation. Assistive devices like a cane can provide extra support and stability. And, in severe cases, when other treatments fail, hip replacement surgery can be a life-changing option. Now, let's move on to another common source of hip discomfort, bursitis. While osteoarthritis involves the cartilage inside the hip joint, bursitis affects the structures around it. To fully understand bursitis, you need to know about bursae. Bursae are small, fluid-filled sacs that act as cushions between bones, tendons, and muscles. They're strategically located throughout the body, including several around the hip joint. Their purpose is to reduce friction and allow these structures to glide smoothly over each other during movement. However, these bursae can become inflamed, leading to a condition called bursitis in the hip. The most commonly affected bursa is the one located on the outside of the hip, near the greater trochanter, the bony prominence you can feel on the side of your hip. When this bursa becomes inflamed, it's called trochanteric bursitis. The hallmark symptom of hip bursitis is a sharp, burning pain on the outside of the hip. This pain may radiate down the thigh and can be particularly noticeable when you're lying on the affected side, walking, or climbing stairs. It might also feel worse after prolonged sitting. The good news is that bursitis is often treatable with conservative measures. Rest is key, allowing the inflamed bursa to heal. Ice packs applied to the affected area can help reduce inflammation and pain. Over-the-counter pain relievers such as NSAIDs, nonsteroidal anti-inflammatory drugs like ibuprofen or naproxen can also provide relief. Physical therapy can be beneficial, focusing on stretching and strengthening the muscles around the hip to improve stability and reduce stress on the bursa. In some cases, a doctor may recommend a cortisone injection to reduce inflammation directly in the bursa. By addressing the inflammation and supporting the surrounding structures, you can often find significant relief from hip bursitis. While osteoarthritis and bursitis are common culprits behind hip pain, we need to address a more serious cause: hip fractures. A hip fracture is a break in the upper part of the femur, the thigh bone, near the hip joint. These fractures are particularly concerning for seniors due to the increased risk of complications and the potential for long-term disability. The primary cause of hip fractures in older adults is falls, often exacerbated by osteoporosis, a condition characterized by weakened bones. Osteoporosis makes bones more brittle and prone to breaking, even from minor falls that wouldn't cause a fracture in a younger, healthier individual. The symptoms of a hip fracture are usually quite dramatic. The most prominent is severe pain in the hip or groin area. You'll likely be unable to move your leg or put weight on it. The leg may also appear shortened or rotated outward. A hip fracture requires immediate medical attention. Treatment typically involves surgery, either a hip replacement where the damaged hip joint is replaced with an artificial one, or pinning, where the broken bone fragments are held together with metal pins, screws, or plates, following surgery. A period of rehabilitation is essential to regain strength, mobility, and independence. This usually involves physical therapy to improve range of motion and muscle strength, as well as occupational therapy to help you relearn how to perform daily activities safely. However, the best approach to hip fractures is prevention. Fall prevention strategies are crucial, including addressing hazards in the home like loose rugs or poor lighting, using assistive devices like canes or walkers if needed, and maintaining good balance and strength through regular exercise. Bone density screening is also vital to identify and treat osteoporosis early, reducing the risk of fractures. Taking proactive steps to prevent falls and strengthen bones can significantly decrease the likelihood of experiencing a hip fracture. Now let's shift our focus to another potential source of hip pain: tendinitis. While hip fractures often stem from a sudden, traumatic event, tendinitis typically develops gradually over time, often as a result of overuse or repetitive strain. Tendons are the strong, fibrous cords that connect muscles to bones. Around the hip, several tendons play a crucial role in movement, including those of the gluteal muscles, buttocks, the hip flexors, and the adductor muscles, inner thigh. Tendinitis occurs when these tendons become inflamed, usually due to repetitive motions or excessive strain. The primary symptom of tendinitis is pain that worsens with activity. You might notice a dull ache or a sharp pain in the hip or groin area, which intensifies when you walk, run, climb stairs, or perform other weight-bearing activities. The pain may also be present at rest, but it's typically less severe. The good news is that tendinitis is often manageable. With conservative treatment, rest is crucial, allowing the inflamed tendon to heal. Avoid activities that aggravate the pain, and consider modifying your exercise routine to reduce the stress on the hip. Ice packs applied to the affected area can help reduce inflammation and pain. Over-the-counter pain relievers such as NSAIDs can also provide relief. Physical therapy plays a vital role in tendinitis treatment. A physical therapist can teach you specific stretching and strengthening exercises to improve flexibility, strengthen the muscles around the hip, and support the affected tendon. It's important to gradually return to activity, increasing the intensity and duration of your workouts slowly to avoid re-injuring the tendon. By combining rest, ice, pain medication, and physical therapy, you can often effectively manage tendinitis and get back to your active lifestyle. Finally, let's discuss a somewhat less obvious but still important cause of hip pain: referred pain. Sometimes the pain you feel in your hip isn't actually originating from the hip joint itself, but rather being referred from another area of the body, most commonly the lower back or spine. Think of it like this: nerves are like electrical wires, transmitting signals throughout your body. When a nerve is irritated or compressed in one area, It can send pain signals that are felt in a different location along the nerve's pathway. The lower back and hip share many of the same nerves, which means that problems in the spine can often manifest as pain in the hip. Common conditions that can cause referred hip pain include spinal stenosis, narrowing of the spinal canal, degenerative disc disease, breakdown of the spinal discs, and sciatica, irritation of the sciatic nerve. With referred pain, you might experience pain that radiates from your lower back down into your hip or thigh. You might also have other symptoms, such as back pain, numbness, tingling, or weakness in your leg. The key to addressing referred hip pain is to identify the underlying source of the problem. This typically involves a thorough medical evaluation, including a physical exam and imaging tests, such as X-rays or MRI scans of the spine. Once the source of the pain is identified, treatment can be targeted to that specific area. For example, if the pain is coming from spinal stenosis, treatment might involve physical therapy to strengthen the back muscles and improve posture, pain medication to manage the pain, or, in some cases, spinal injections or surgery. By addressing the root cause of the problem in the lower back or spine, you can often effectively alleviate the referred pain in your hip. We've covered a lot of ground today, exploring 5 common causes of hip pain in seniors, from osteoarthritis to referred pain. But before we move on to general tips for managing hip pain, it's crucial to emphasize the importance of accurate diagnosis. While this information is designed to be helpful and informative, it should not be used as a substitute for professional medical advice. If you're experiencing persistent hip pain, it's essential to seek a professional medical evaluation from your doctor or a qualified healthcare provider. Why is diagnosis so important? Because, as we've seen, hip pain can stem from a variety of underlying conditions, each requiring a different approach to treatment. Trying to self-diagnose or self-treat your hip pain can be risky and may even delay proper treatment, potentially leading to further complications. A doctor can perform a thorough physical exam, review your medical history, and order imaging tests, such as X-rays, MRI scans, or bone scans, to determine the exact cause of your hip pain. Once the underlying condition is identified, your doctor can develop a personalized treatment plan tailored to your specific needs. This treatment plan might include medication, physical therapy, injections, assistive devices, or, in some cases, surgery. The key is to receive the right treatment for the right condition. So, if you're experiencing persistent hip pain that's interfering with your daily activities, don't hesitate to seek professional medical help. Early diagnosis and treatment can make a significant difference in your pain levels, mobility, and overall quality of life. Don't let hip pain hold you back from living your life to the fullest. Take the first step towards relief by consulting with your healthcare provider. Regardless of the specific cause of your hip pain, there are several lifestyle modifications you can make to help manage your symptoms and improve your overall comfort. These modifications can complement your medical treatment and empower you to take control of your hip health. One of the most important steps you can take is to maintain a healthy weight. Excess weight puts extra stress on your hip joints, exacerbating pain and inflammation. Losing even a few pounds can make a noticeable difference in your hip pain levels. Regular, low-impact exercise is also crucial. While it might seem counterintuitive to exercise when you're in pain, the right kind of exercise can actually help strengthen the muscles around your hip, improve flexibility, and reduce stiffness. Good options include swimming, walking, and cycling, as these activities are gentle on the joints. Avoid high-impact activities, such as running or jumping, which can put excessive stress on your hips. Using proper body mechanics is another key to managing hip pain. When lifting objects, bend your knees and keep your back straight. Avoid twisting your body and try to distribute the weight evenly. When sitting, use a chair with good back support and avoid slouching. Finally, it's essential to avoid activities that aggravate your pain. Pay attention to what makes your hip pain worse and try to modify or avoid those activities. This might mean taking more frequent breaks during activities, using assistive devices like a cane or walker, or finding alternative ways to perform tasks that put stress on your hips. By incorporating these lifestyle modifications into your daily routine, you can significantly reduce your hip pain and improve your overall quality of life. Remember to consult with your doctor or physical therapist for personalized advice on the best exercises and strategies for your specific condition. In addition to lifestyle modifications, assistive devices and home modifications can play a significant role in improving safety and reducing strain on your hips, making daily activities easier and more comfortable. Assistive devices such as canes and walkers can provide extra support and stability, reducing the weight and stress on your hip joint. A cane can be particularly helpful if you have pain on one side, while a walker can provide more overall stability. Your doctor or physical therapist can help you determine which type of assistive device is best suited for your needs and ensure that it's properly fitted. Raised toilet seats can make it easier to sit down and stand up, reducing the strain on your hips and knees. Grab bars installed in the bathroom, particularly in the shower and near the toilet, can provide extra support and prevent falls. Home modifications can also significantly improve safety and reduce the risk of falls. Removing tripping hazards, such as loose rugs and clutter, is essential. Ensure that hallways and stairways are well lit. Consider installing ramps instead of steps, if possible. Modifying your kitchen can also make a difference. Rearranging cabinets and countertops to bring frequently used items within easy reach can reduce the need to bend or reach. Using adaptive kitchen tools, such as jar openers and long-handled utensils, can also make cooking easier and safer. These assistive devices and home modifications can significantly improve your safety, reduce strain on your hips, and allow you to maintain your independence and quality of life. Don't hesitate to explore these options and discuss them with your doctor, occupational therapist, or a home safety specialist to determine the best solutions for your individual needs. Creating a safe and comfortable environment can make a world of difference in managing your hip pain and staying active. So, we've reached the end of our journey, and hopefully you're feeling more empowered to manage your hip pain and take control of your well-being. Remember, hip pain doesn't have to be an inevitable part of aging. Be wise understanding the common causes, adopting proactive management strategies, and seeking professional medical advice. You can significantly improve your mobility, independence, and overall quality of life. We've discussed osteoarthritis, bursitis, hip fractures, tendinitis, and referred pain, highlighting the importance of accurate diagnosis and personalized treatment plans. We've also explored lifestyle modifications, assistive devices, and home modifications, all designed to reduce pain and improve safety. The key takeaway is that proactive management is essential. Don't wait for the pain to become unbearable before seeking help. Early intervention can make a significant difference in your long-term outcomes. Remember, you are not alone. Many seniors experience hip pain, and there are effective treatments available. The information we've provided today is a starting point, a foundation upon which you can build a personalized plan for managing your hip pain. Ultimately, our goal is to empower you to live a full and active life, free from the limitations imposed by hip pain. Take the knowledge you've gained today and use it to advocate for your health. Consult with your healthcare providers, explore different treatment options, and make the necessary lifestyle changes to support your hip health. Be wise working together with your medical team and adopting a proactive approach. You can conquer hip pain and reclaim your mobility, independence, and zest for life. Don't let hip pain define you. Take control, stay active, and live your life to the fullest.